family, business, death. These are all what's made up of life. Life sometimes can be very confusing. That is why I am coming on Life Matters, a program that seeks to address all life issues, real talk, real discussion. We all have a story to share. Let's talk about it on Life Matters.
Every Saturday, 2 to 3 p.m. on Jericho TV. I am Kadichedi, your host.
Religion, culture, education, lifestyle, fashion, health, family, business, death. These are all what's made up of life.
And it's a beautiful afternoon. Let me remember you that it's the 6th month in the year. And of course, the year have not ended. The 6th month have not ended. And so your goals that you have set for this month can come to pass. My name is Kadichedi, and this is Life Matters right here on Jericho TV. I am glowing with crayons, makeup, and nails. She can be located at Pobima Bus Stop, and she's on all social media platforms at Crayon Makeup and Nails. Let me also remember you that we are live on all our social media platforms, Facebook, Instagram, YouTube, at Jericho Media TV. Please subscribe, hit the notification button. Anytime we go live on our platform, you get to enjoy all our content. Life Matters. Jumede bia yedi abrabom ko concern hina ewa ha. De bia me catch you say jumede we so asem bia ne ho a wo de som yen ana wo de ba ye nima ye ma wo ho eye emuaye nene ye betwetwe nkomo soro nkokra na menim say ye besua bibi na fe yakọ ye ho bai efi nyare wa mu bebre se ye segment bia no we a health segment our Life Matters jumedi so I mean kai won so say na health segment yi ye be didi nkomo afa TB yare wa ho ena the implications se TB yare edru eni ewo eni Ghana ha e de ma me ne wo niwe a ade a ebetumi abayen so the implications of the shortage of TB drugs in Ghana. And I'm very, very honored to have a great man here with me. And he is in the person of Mr. David Kwesi Afre, and he is the Executive Secretary of Stop TB Partnership Ghana, member of Country Coordinating Mechanism of the Global Fund, and the Chairman of Oversight Committee of the COVID-19 and Pandemic Preparedness. And this is the man I have here with me in the studio. Hi.
Hello,
Mr. David.
Yes, my dear.
How are you doing?
And the Lord is good.
And his mercies endure forever.
Forever.
Welcome to Life Matters.
Thank you. It's a pleasure.
I'm glad to have you here because I've been training you, sir. And today I have you here with me. And it's also a great privilege because today we're going to discuss something very important. This is I'm going to try not to be personal because TB disease has taken my senior sister who we buried just last April. And so when it comes to end, I mean, shockingly, she didn't show any symptom until the latter part. Until the latter part.
Oh, okay.
Yes. So when we started noticing, in fact, she stopped eating eventually. And then during the time she stopped eating and taking in more water, we realized that they said, not really, well, I say it's a cough, not really a cough like that, because I always say that she didn't show us symptoms at all, because the little coughing we experienced within some few days, we took her to the hospital because she's already felt sick for some time.
Yeah.
I mean, we've done a lot, and we did a series of labs, tests, and all that. I have done 2 different chest x-rays which didn't indicate TB at the beginning or at the peak of her disease. It was actually the last scan, the chest x-ray, that actually led us to the condition. And when our report was ready, she died that day.
Oh my goodness. And so I think she was unfortunate. It's probably not a TB of the lung. You know, TB can affect any part of the body.
Okay.
Any part is any part.
Okay.
Even your fallopian tube.
Okay.
It can attack the bones, the brain,
Okay.
the spinal cord. And,
Okay.
and
I think
so,
that hers quite was related because she was on oxygen.
Oh,
Yes, she was on oxygen, and so even for us to take the X-ray was quite a very strategic one because we quickly have to finish the X-ray and put her back on the oxygen.
oh.
So she went on the oxygen for 2 days before she passed.
Wow, wow.
Yeah, that is it. So we want to know
I'm
what.
sorry, I'm sorry.
It's well. It's well, but you know,
eh.
because I am coming from the medical field,
Yeah.
it was quite a blow for me for not realizing that my sister
That's
is.
early,
I mean, I couldn't accept it. That like, come on,
How you
how
didn't
could
pick
this
it up?
escape me? Like, but yes, it
has
happened.
It has happened.
TB disease. What is it?
It's a bacterial infection. Just as COVID came to this country, somehow, anyhow, and we all went on a lockdown several years back down history. TB was also
Oh my God.
discovered. It was declared at one time, I think earlier, some 24 or so years ago, by even the United Nations General Assembly as an emergency, just as COVID
became an emergency. Yeah.
And so since then, of course, it has been a system and causing so much harm to generations. And so TB is a bacterial infection. Unlike COVID, that is a virus, this is a bacterial infection. Forgive me, that commonly affects the lungs.
Yeah.
And so if you cough for a couple of days, weeks, you should be
able to be tested for TB as well.
You should be sensitive
because
to know
cough
that you
and
could be
cold
suffering from
itself
TB.
is also an infection.
Yes.
The common cold disease is also an infection.
Exactly.
So your mind shouldn't really be that you are suffering from maybe
TB.
just a normal cold. But just as you are treating your normal cold, you should be able to be tested for TB as well.
Exactly. And so especially when you in the night you are sweating when it is cold.
Okay.
And you have a bit of cough it's giving you the rib pains.
Okay.
And
okay.
see, some cough come that you can feel that the cough is coming from the lung.
Yes, because you are coughing and struggling to breathe at the same time.
And you have sputum
especially
production.
The dry ones.
But in this case, we're looking at a cough that has the sputum coming out. And then that is more of TB. It's more likely to be TB.
Okay.
You have headache, you have fever, normal malaria fever. And so if your sister had to treat fever, had to go on some painkillers, I've had to have some night sweats, and then eventually losing appetite for food. That was the
some of these are the symptoms to look out for the TB disease.
For the TB disease. And you see, because it can affect any part of the body, you may not have the person coughing. So somebody may be sick of TB, but it's not coughing
because it hadn't happened to the pulmonary lungs.
You understand. And so then I guess that is what your sister suffered from.
Okay.
And so in most of the cases, we look out more for TB of the lung. And so it's more of cough. You are looking at an algorithm that is looking at scientific algorithm that is looking at, is the person coughing? Okay, so the first thing the doctor wants to see is you're coughing. Because
and now if you are suffering from TB and you are coughing, you might be mistaken for COVID.
Yeah.
Because it also has the same chain of symptoms and signs.
Yes, you are right. So you see, when COVID was there, we had more of COVID in 2020, 2021, the National TB Program, that is for the control of TB, was doing the dual testing.
Yeah.
So if you were taken for specimen for COVID, we test the same
specimen for TB. Okay.
So then there was that dual testing.
So that they don't mistake a TB disease to COVID.
Yes, and you can actually be suffering from the two.
At the same time.
Yes, you can. And you can actually be HIV positive, COVID positive, TB positive.
Yes.
And so they are looking out for any such situations, and then you are given some good care.
Okay.
Because the treatment for these diseases are all free. Okay. Of course, treatment for TB is free.
Okay.
And so the most important thing for us to know as Ghanaians is how do we detect it early?
Yes, so I was about asking of the mode of spread.
Okay, so We are in a beautiful room, isn't it?
Yes.
As we speak, the droplets that come out of our mouth is the principal communicating route.
Yeah. Okay.
So as you shout, as you sing, as you do anything.
As we hug and as we high five.
Well, high five is not part of it. The pagans are not part of it. TB is airborne.
Oh, it's an airborne disease.
Okay, so let's be careful.
Okay.
TB is airborne.
Okay.
It's a bacterial infection that is airborne.
Okay.
And so you don't eat in a bowl with me and have TB. You don't have sex with me and have TB. It is not transmissible through the blood.
Okay.
It is an issue of air.
Okay.
And so it's transmitted through the droplet of saliva that comes out of our mouth, principally.
Okay.
Okay, so that is why you need to live in environments that are airy. Because now it's important for us to know that the situation of TB is such that it's like all of us have become TB infested. Because the bacteria, some way, somehow, we all have the latent TB, you know, so we have the active and the latent TB. So you have the bacteria infection somehow inhaled already, and you are presumed to, silently be living with some kind of TB or bacteria in you. But then it will take some time where you are having low immunity
system,
Okay, so
before
then
the actual symptoms
begin
to
for
the
pop up.
body to get weak.
That's right.
And be able to
then
identify.
they can identify and treat you, and that's. I guess when we are in the buses, when we are in the air-conditioned studios, we drive around, we are sitting in the airplane, and we live in a bedroom where we are all suffocating, where we grew up from the poor families where you have 4, 5, 6, 7 children with their parents virtually in one room. With sometimes no window at all. I don't remember any window in my mother's. I grew up with my mom, but I don't remember any window at all around the room. But we have 2 doors. And so those are, I can remember vividly, it's when I became a TB advocate that I could remember clearly what killed my sister's father. TB is real. It's been killing from since ages. Is real. And so we need to create rooms for people to live in very airy environments and eat healthy and make sure that...
definitely I'm going to ask you of the preventive method, because you've made us understood what TB is. TB is bacteria, diarrhea. Diarrhea be airborne. To show kake free no ba betumi enya yare ni bi afef free mu afen so say bia na me bo wa bon say wa na wo boy atwe wo mfe no wo mfe ehwu wom so ana say awo wom so awo ehwu de me ana say ehwu wom so awo de me no betumi eno so betumi ayeye TV afen so betumi ama me yi amaman
exactly.
Inti no ebetumi ama me hwene ayedru ana menya mu ko se wo me hwene mu ana.
Yes, it's possible. I mean, cold fever, cough. I mean, body pain. We need to have high sensitivity to TB. It's one of the
your doctors are share your pomodin Ghana ha. TB awareness state at the same. If you say sometimes so no few make us say a miracle doctors. And what kind of symptoms trauma quickly catch us and go and test for TB. But at the moment your mouth collab. I just said now we have a trend of general labs be like the lipids, the full blood count, the malaria, and one I'll be no matter your complaints. Even if it is common, even with children, they will still let you go and do full blood counts. And by the time my doctor who said I get TB, now I to the point
So you see, that is why the National TB program, at this moment, let me say good afternoon or evening to Dr. Yawedu Sifoku,
okay,
the National TB program manager, and a very wonderful gentleman.
Okay.
He's the head of the National TB program. And then maybe my board chairman, Eric Kwabena. Yes, they are doing a wonderful job in the country. You see, so the program is having intensified case finding. Okay, so it has over the year been identified that doctors may not be sensitive to enough. See, their index of sensitivity to remembering, say, cough betting a TB, no, low. It's very low, and so the program has a strategy which we call intensified case finding.
Okay.
So in the hospitals, in the district hospitals, especially, you have what we call the task shifting officers for TB.
Okay.
And so it is their duty to...
Are they the ones called the DOTs?
No, that is direct observation treatment.
Okay.
The task shifting officers are responsible for being sensitive to those who come to the OPD.
Okay.
To pick TB cases.
Okay.
So their role is to make sure that the nurses who are taking the vitals and all of that also screen
for TB. Okay.
So that is their work.
Okay.
So that once you are coughing, at least once you are coughing, you should be given, you should be screened for TB.
Okay.
And if you are presumed to be
infected,
yes, then the samples are taken and then moved to the laboratory. So whatever it is that may have brought you to the hospital, the program of TB is sensitive to make sure that once a symptom or two are identified, you
should be screened for
TB. And so that is helping. And so it is no longer really an issue of the doctor.
Okay.
But it is, of course, a program thing that is streamlined into the system to help us identify so we don't miss the cases. Yeah. But of course, the communities, NGOs are also involved. The Stop TB Partnership Ghana is helping the National TB program in a response.
Okay.
So there are places, for example, that the program cannot reach. The program is working with the Ghana Health Services.
Okay.
The district hospitals, some private hospitals, the regional hospital, and all government facilities you can think of.
Okay.
Okay. And sometimes down to the CHIPS compound in the sub-districts. Of course, if somewhere is not being reached, then it is financial matters. Okay. We'll leave that for
I'll come to the challenges. So it's very important. We will not leave it.
But I want to say this. Yeah.
Finish.
So the CSOs, the NGOs, the community-based organizations that are working with the Stop TB Partnership help the program by going to hard to reach communities.
Okay.
Whether in urban, peri-urban, or rural communities, where it's difficult to reach human beings. The NGOs are able to use motorbike, bicycle, or walk on foot to go and screen. So then the NGOs are doing what we call proactive TB case finding.
Okay.
So you see, the program is doing intensified case finding.
Yeah.
And the NGOs, or Stop TB Partnership Ghana, and its implementing partners are using the proactive community screening. Okay. So they come to the people instead of the people coming
to the facility.
Those who may never come to the facility, they are reaching them.
Yeah.
So they have the chance to be reached by some volunteers working with the NGOs. And so that is the situation.
Okay. So is TB treatable?
Oh yes, it's not just treatable, it's curable.
It's curable.
Okay, there is treatment for TB.
Okay.
And you can go on treatment for 6 months. In fact, it used to be more than that, but then normal TB is 6 months.
6 months.
In fact, we have what we call the drug-resistant TB. We have what we call the multi-drug-resistant TB. And you can even have the extra multi-drug-resistant TB. Yeah. And in the earlier days, before this year, we had a situation where some people could be on treatment for 11 months. The multi or extra can go into 2 years.
Yeah.
You'll be on medication for 2 years, taking medication every day. But now, science has helped all of us.
Okay.
It has reduced all of the 2 years, 11 months
Okay.
of whether it's drug resistance, multi-drug resistance, or extra. They are all treatable within a space of
So
6 months.
Okay, so now it's curable, it's treatable. When it comes to treating TB, what are some of the challenges?
Maybe let me be quick to mention that treatment for TB is free.
Okay,
Okay,
it's free.
It's free for the patients.
Okay.
If you are diagnosed TB positive, you don't pay anything.
Okay.
Indeed, if you walk into the hospital today and you say that, I suspect myself for TB, and you go straight to do TB screening, you don't pay anything.
Okay. So the screening for TB at the hospital facility is free?
It's free.
And if you are screened, tested, and proven positive, treatment is also free?
It's free. They give you the medication for free. And if you are multi-drug resistant, or if you are drug-resistant TB patient, it's more difficult for you because of the nature of the drugs you take. And so you are given even some enablers package, depending on what you may need.
Okay.
Yeah, some it may be nutrition, some may not be nutrition, some may be transportation, some may be some other thing.
Just to ensure that
you are able to, yeah. It's a human right thing. TB treatment is human right. TB services is human right. And so treatment is free.
Treatment is free.
It's free.
So what are the challenges that this free treatment is encountering?
Yes, of course. You can imagine somebody on treatment. It's a cocktail of drugs for 6 months.
6 months.
To take an antibiotic that is for 3 days, I have missed some before.
Okay.
And when it's 7 days, you can imagine. And now it is 1 month, 2 months, 3 months, 4 months. And so there are times that some people are lost to follow up.
Okay.
Because you are supposed to be giving the medication, used to be what we call it is direct observation treatment, which means that swallow the medication in front of the doctor.
Yeah.
Now that also has become a bit more of community-based, and therefore you don't need to be in front of a doctor. You don't need to walk into a hospital every day to take the medication. Okay. But then medication is brought to your doorstep, and you have a volunteer, you have a nurse, you have some community person, you have a treatment supporter who is supposed to help you, counsel you, and ensure that you take the medication. But people still, you see, what happens is that when you're on treatment for 2 months, 2 weeks, you are no longer infectious. Okay. Okay, so, and depending on the stage your TB is, your disease is, before you are diagnosed, you may be healed earlier. Okay. Let me put it this way. The symptoms will go away maybe in the months or 2 or 3, but you are not cured. Okay. So somebody may say that, but I'm fine. Why should I continue taking the medication? So it's obviously a challenge. Some people may be lost to follow up. You understand? And especially when the nurses are on you, the volunteers are on you, NGOs are on you, wanting you to take the drug. Some people are resistant. It's like, why are you forcing this drug on me? And I'm fine now. You see that? And
I'm looking better.
I'm better.
If even the drug could make you look more fresher and better than you were before.
Yeah, of course. I mean, once you are taking medication well, you are eating well. And so some people too, what's the problem? They are not able to have money because you need to eat well. Because those days, there used to be support from the Global Fund for Enablers package for every TB patient. So at least you have some good Tom Brown, you have some egg, you have something that you can eat every day until you are done with your treatment. But now, Global Fund says that, you're not going to have that as a country. If you think that you want to give food to your patients who are on treatment for TB, let your government provide it. Now here we are. Wow. When majority of your TB patients are poor people. And eating is a problem.
And aged, disabled, and can't work.
Everybody. Children are on treatments. Aged are on treatments. And so poverty is a vital problem.
So it means that the government's failing to provide these packages for TB patients in their own country. It's a big gap. It's also a big gap.
So that is the reason why you have a lot of people who die of TB. Some, maybe you be on a medication, but not because you don't have good food. Yeah. The medication will not work, and therefore, so this is some of the challenges. I mean, as a TV program, they have the financial challenge. Of course, you are not able to reach everybody you need to reach.
Okay.
As a program, okay? You need medication, you need cartridges, you need.
Why do these challenges happen more to the developing countries compared to the Western? Because they are, if somebody is in the UK, in the Netherlands, and is having TB, you know, all these packages will be, probably may even get an insurance cover or something for going through all your treatment. Yet when it comes to the developing country, it seems that is this a method they are applying that we cannot apply here, or is it something that they have that we don't have that brings us that huge gap, and then this becomes so much of a challenge for the developing countries?
Well, this is a social political question. We are living in a continent, we are living in countries geographically protected by leadership. And if you ask me, everything rises and falls on leadership.
Okay.
Leadership, political leadership, it's crucial. Developed nations prioritize their things the way they do.
Okay.
Do they have budget deficiencies? They are the donors. They are the people who send down money to Africa. How much is Africa managing its own resources, and what are the priorities? Is health a priority for Ghana? Is health a priority? How much of our budgets annually go into
healthcare,
health service delivery?
Yeah.
National health insurance. How many of the diseases that are killing the poor can be treated for free under the national health insurance? Yeah. And so it means that there is the need for
a lot of challenges.
We need to get strong leadership.
Okay.
We need to reorganize our natural resources.
Okay.
So that the monies that come to the baskets of the country to manage is not from only IMF, from
and the other funds,
taxes that are not even there because the people are majority are poor. And so for me, it's about reorganizing the economy and prioritizing health. Now, there is an Abuja Declaration, as in 2002, and governments of the nations of Africa are committed to that declaration, which suggests that you should use 12% of your annual budget to service health service delivery. Yeah. But how much of the budget do we have? There are times our budget are around 8%, some at 7%. I remember at a point in time we had about 11, 10. Yeah. And so sometimes it's come well, sometimes it's not.
It's not.
But what are the priorities? Are we tackling the things that are killing our people? How much are we dealing with? We are talking about thousands of people on TB treatments every day.
Every day?
Yeah.
For 6 months?
Yes. And every day somebody comes on treatment.
Yes.
Every day.
And each day there will be definitely a diagnosis of
every day. It's TB. Daily. Every day.
Now there is I know currently. I know currently because I was even saying that at a point I said, oh, Charlie, if my sister had even been well diagnosed, she will still not be able to be on treatment because there is no drug in the country. How is this affecting us as a nation? The shortage of TB drugs.
So you see,
so it's like if we are diagnosed, your treatment in Ukraine becomes you and God.
Yes, as we speak, shortage is looming. There is shortage. There is shortage now. There is shortage now, and it's dangerous. I don't know. I don't know where to start from, but we've tried as much as possible, Teddy, to look, the government actors, the Minister of Finance, Minister of Health, Ghana Revenue Authority, Ghana Port and Harbour Authority. Look, maybe the national security should get to understand that this is a national security matter.
Yes.
We are talking about more than 4,000 people on TB treatment.
Yeah.
Okay. In the last, by March 31st, we had more than 4,000 human beings on TB treatment in Ghana. And as at today, I don't know how many will add to it.
Yeah.
We're probably running around 6,000 people who are on treatment. And
yet there is no medication.
And we are talking about people who are coming from January. So if somebody started treatment in January, they'll end around July. And so we have like
a lot.
Okay, people who are supposed to be swallowing drugs every day and they're not having it. We have had a container that is containing these drugs.
Okay.
Locked up in the port since 10th of February.
Oh, wow.
Yeah. This container has been in the country and clearance has become a problem.
And there is expiring dates to the medication.
Oh, yeah, I mean, take it or leave it. No drug comes without expiry date. And look, it's so serious.
Goodness.
It's so serious that, look, everywhere I go,
goodness.
I call, look, maybe everybody else is failing. Maybe the Minister of Finance doesn't know what to do. The Minister of Health doesn't know what to do. The old ones have been in power before the reshuffle or the realignment. I don't know which thought to say, but Honorable Koboy, Minister for Health, just came, and this is the problem that's looming. Yes. Honorable Kokwachimamenu couldn't handle it and left. These containers have been in the port.
It's there.
It's there.
On our shores.
And it is only one port. It's there at Tema.
On our shores.
It is in Tema.
Right now.
Where is our port? It's at Tema. Tema Harbour.
Are you sure?
Oh, I am.
Maybe it's at a different port, so getting into our port and coming out.
Partnership.
It's there. The containers are there in Tema.
I've been the chairman of the Scottish Partnership for 7 years, 6 years. The containers are at the port.
At Tema?
Yes.
As we speak?
As we speak. It is entered Tema port on the 10th of February. I'm giving you dates. You understand? And we have
So Stop TB Partnership Ghana and all the TB rep at the parliament, what are you doing to get these drugs? My sister is gone and I can't have her back.
So you see, we call all the media. So this is not just about TB. There are about 200 containers that have been locked, some like 2 years ago.
Oh.
Okay, the TB one, which is just one container out of
the lot.
The lot. It came on the 10th of February. Okay.
Because I know HIV/AIDS also.
HIV and malaria commodities are all part of it. Yes. And so if you are current on the news, you will know that the civil society into TB, HIV, malaria, and other stakeholders of civil society, we called a press conference, called on all the media to come, and it took like one whole week. Everybody was discussing this in this country, but still we are not making headway as much as we should do. And so there are various media engagements, and we have gone to
the various
you understand,
institutions.
Before civil society will come to talk to the media, we've done all the diplomatic engagement.
So you've done all the diplomatic engagement. I want to ask you this very simple question. I need a really, really straight, simple answer. Do you think, from your view, that these drugs are coming into the country?
Well, I think the president must come in. It's money, it's commitment from the government. I mean, it should come. The container is in the country. We just have to take it out of the harbor and bring it to the central medical store, which is also located around the same place, and then it starts going to the regions. It's just if I don't know. The minister just look. When we had discussions with a tripartite discussion, Ghana Revenue Authority, the Global Fund on one side, Ghana Health Service at another, Minister of Health, you know, what is the situation? Okay, so simple agreement. Okay, where we are now, we have an emergency.
Yes.
Government of Ghana is supposed to pay some amount of money to the authorities at the port or whatever.
Which was the same authority, the same.
Is Ghana Port and Harbour not for Ghana?
Yes.
Is the Ghana Revenue Authority not for Ghana?
It is.
Am I right?
Yes.
Or I am confused, or you are confused?
No, I'm not.
Okay.
It is. So it's the same question I'm asking. It's
donors,
like a father. It's like a father whose child is in the secondary school, and the child said that, "Daddy, my things are short, and I just came to school 3 weeks. Everything you give me is finished. So please, can you come and bring me some?" And the father is like, "You just went to school 3 weeks with everything I've given you."
You see. Look,
that is why I asked you, from your view, it's leadership.
You see, Look,
Is
when
it
we had a
coming
discussion, when
or
we had
not?
a,
Because we are in the rainy season.
I'm afraid. I don't even know what to say. But
malaria is on the rise. We are in the rainy season. June, July is a rainy
we
season.
need
We need our malaria. We need our
we need all of them.
everything,
We need all
including
of
the
them.
TB.
We need all
because
of
this
them.
season is also
We
really
need
a
all of
risk
them.
season
We need all
for
of
any
them.
TB patient because the cold,
Yeah.
you yourself, your lungs is affected.
Yeah.
And so the coldness to the body is also going to raise your body in a way that if you are not lucky, maybe we may encounter a lot of death.
I don't know. There is a payment that has to be done. Global Fund has paid Porsche about $86,000 in the last 2 weeks or so. And as we speak, there is clearance that has to be taken. The Ministry of Finance has to give the clearance.
Okay.
And that is where we are. And for the whole of this week.
Okay. Maybe because of the reshuffling and all that, they have to wait for
No, there is an emergency. What is the chief director doing? We don't need a minister before the system works. The system is run by the chief directors.
Yeah.
These are the civil servants. They're responsible for the people. The politicians are politicians. They control power. But if they have come and there is a challenge that has an emergency. Now, do you know what it means when, you see, when people are lost to follow up on TB treatment, that is when the issue of drug resistance comes in.
Yes, because the body will grow immunization to the medicine taken previously. And this time, when you take it, it will not be working.
Now, imagine we putting 4,000 people at the risk of developing drug-resistant TB or eventually multi-drug resistant TB.
Another extra cost.
No, the country is at risk. That's what I want us to know. It's a pandemic. As we speak, we have 54 currently. We have, as of yesterday, I don't know any of the diagnosis of today, but we have 54 multi-drug resistant TB patients in Ghana. And we have more than 6,000 people on treatment.
Yeah.
If all these people become drug resistant,
that means the drug at the port crowd will not even help us.
Are you getting it? It's an emergency that must be dealt with
and
today.
We have to look for another years to get a new drugs that will probably help them. This is really a wake-up call for us, for Ghana and Ghana Health Service and the TB partnership, Stop TB Partnership Ghana. My time is up. I wanted to have opened the phone lines. I wanted to have opened the phone lines, actually. I think I have 1 minute, but I don't know what my producer can do. Can we open the phone lines, please? Can we? Can we open the phone lines, maybe just for some 5 minutes for us to wrap up and listen to our viewers, their concern when it comes to, it's not only TB, it's not only TB, it's not only TB. 053-256-1189, 053-256-1189. This is the line you can call us and bring your contribution on the discussion. Implications of shortage of TB drugs in Ghana. Enye TB yariwano edra entumi emba na ebi ni honkwa ye wo yariwa mo bi ti say HIV AIDS ye malaria duro yi na de sisi a ukoto malaria duro pharmacy a nyame aye wadom obeto ni 60 Ghana cedis 40-30 Ghana cedis because nyanka bai no de be boa ye ni ewo kwa and at least no abibia kwa health no be kaba. But uko hospital hon na ye show we na uko na ye sekona koto uko pharmacy ni susu a usika na so na wo say wechi edeba. The implications of shortage of TB drugs in Ghana. 053-256-1189 and 0549-673-449 is our WhatsApp number. I have a lot of WhatsApp messages, but I really need a signal from my producer if I can read it. I can read this. My WhatsApp messages and Mr. Franny, Mr. Afra, what's your advice? What's your advice, Mr. David? What's your advice and your final take on this? But Albertina Ediway Sapema, or say I'm a nurse, and it's really painful that you have patients that are going through diseases without medication. Government should please help us release these containers for us. Albertina is bringing this from Sapema. Thank you, Albertina. please, your final take on our topic, and you being the secretary for Stop TB Partnership Ghana, you know, holding all these, the pandemic, the readiness and all that. What do you have to take from your perspective, from your office? What do you need? What do you want from the government so that these containers will be released for you?
Teddy, we have an emergency at hand. The situation we are describing is a looming pandemic.
Okay.
Take it or leave it.
Okay.
If we don't take care. The Ministry of Finance, the Minister of Finance.
Okay. Should step in.
The Minister for Health.
Should step in and help.
The Director of Ghana Port and Harbour.
Should step in and help.
The Director of Ghana Revenue Authority.
Should step in and help.
The National Security Coordinator.
Should step in and help.
Let's have an emergency meeting and clear this thing quickly. It is government. If there's any money to be paid and it cannot be paid tomorrow, but the container can be removed by order, maybe the president should just come in. I don't know. We have an executive presidency, isn't it? Let the president make a telephone. Let's move the drugs out before people start dying.
Yeah.
We can pay debts, but we cannot revive people who die.
If we die, we
and
can't
when
go
the
to
whole
the
and
pool,
if we have 6,000 multi-drug resistant TB people around us in this country.
So Deborah,
Please.
SU is bringing Deborah is bringing this from Medina. She said, "Good afternoon, Mom. I love your show. Thank you so much. Please, how about, okay, so Deborah wants, yeah, Deborah, all we are discussing is not only for TB, the shortage of TB drugs, but all the other side, like the HIV, like the malaria, all these, they still have containers. In fact, just as he mentioned earlier, like 2 years ago, there are still containers of drugs that needs to come into the country to help the Ghana Health Service and the Ghanaian public as a whole, and it's still stuck at the port. So this is an emergency. It's an emergency. Mr. David, please go ahead.
These officers we have called now,
Yeah.
if they have failed us up to now, then let the president come in.
Okay.
Let the presidents of this nation come in.
Okay.
At least for the TB container. It's just one container.
Okay.
It's just one.
Okay.
How much it is? You see, the freight, the monies or whatever it is, the drugs that have been paid by the donors, Global Fund.
Oh, so
it's not Ghana that bought the drugs.
Order it. We've not paid for the
no.
Drugs
This
that
is
are not
drugs
cleared.
that are paid for by donors, by the Global Fund.
Oh wow.
You understand?
So they are donations.
It's
that
you
needs
see,
to be received.
You understand?
Oh.
And Global Fund has also paid part of the freight, part of the...
to just ensure that
yes.
we also show our commitment just to have the medicine.
Ghana is supposed to pay just a percentage.
Or is there is a hint somewhere that maybe we are not...
So what I'm calling us to do now is, the containers are many, and if you put all together and you lump them, and you are looking at maybe the costs of clearing all, it's big.
Okay, let's clear them in bits. The
TB container is one. It's just one container that contains the drugs.
Okay.
For the next 6 months.
Okay.
Before the next consignment will come. Just one. So let's stop all others. Let's clear the TB one. It can be done tomorrow.
Okay.
It's one container. That one, there's an emergency situation at hand.
Yeah.
His Excellency has to know. Whoever is his briefing person, look, let him hear it. It is simple. One, it's one. We are not talking about 10, no, one long container.
Okay.
40-footer container.
Okay.
This is one. And it's been at the port since 10th of February. How much do we need to pay it to take that one out? Since all of the containers probably cannot be cleared at a go because we haven't paid all that we have to pay. How much do we have to pay to clear that one? Because if we don't clear the TB one today, tomorrow, people has already started missing their drugs.
Yes, people have already started missing their drugs. I believe that this is going to sing well. This is Life Matters. We say life matters, and so live and live it well. Because life matters, this is why we are pushing this cause. That yes, let's value life. If an American die here in Ghana, the American government will come for the body because they believe in life. So let us also believe in life and the life of our citizens, so that anything that will help improve their health, so that they can be sound and healthy in going about their life endeavors, we can achieve it. Thank you very much for you that watch us live on our social media platform. Thank you that watch us on TV. For you that brought in all your messages, God bless you. My name is Kadichedi, and it's been Life Matters. God willing, next week we'll bring you a very special edition on Father's Day. Please don't change your dial. Keep watching Jericho TV. God bless you.